everyone. You're watching Atlanta and Company. I'm Christine Pilara. It's not a topic that many of us like talking about. In fact, many people play the cover-up game to hide those unsightly varicose and spider veins. It's a problem for both men and women, but something can be done about it thanks to VEINatlanta. Here to tell us more is vascular sonographer Ovi Cioloca and VEINatlanta patient Leroy Horning. Welcome to you both.
Thanks for having us.
Well, thank you. Welcome back, Ovi. So, Leroy, tell us your story. You went to go see Dr. Pravasti at VEINatlanta for another issue and actually discovered something about your legs. So tell us what happened.
Well, it's actually this young gentleman alongside of me here. During the examination, he noticed that I was wearing compression stockings. And he asked me if it would be okay for him to take a look. So we took the pressure stockings off, and he was kind of excited. And he asked if he could do a little examination, and he did, and then he called in Dr. Pravasti. And I thought Dr. Pravasti was going to pick himself up off the floor because he took one look at my legs and said, Mr. Horning, you are in serious trouble. He says, you are about ready to break out with ulcers. And if your legs become ulcerous, there's a very, very difficult problem in trying to heal them. So at that time, thanks to this young gentleman, I started treatment.
And Ovi, what happened? Did he have the chronic venous insufficiency that you've talked about before on the show?
Absolutely, sure did. So upon doing the ultrasound, we did discover that there were a lot of problems, underlying problems that he had, which obviously protruded, that we saw physically. That he had, and that's when I decided, you know, we're going to go ahead and move on with this and get Dr. Pravasti involved. And it was good that he came. He came at a good time, and I think he's feeling a lot better today.
And what were the symptoms? Describe to our viewers out there, because maybe it's not just about, like, I have little spider veins, but it's not, I mean, when they are bigger veins, was that, you know, physically, how did they look, but also how did you feel?
Well, physically, they were very, very ugly. And how did I feel? It really wasn't a question of how well I felt, because I did feel well. The compression stockings seemed to alleviate the problem. However, once the treatments were begun, I referred to an old Judy Collins song from the 60s, and that is, you don't know what you got till it's gone.
Yeah.
And after the treatments began, there was such a remarkable change in my legs and my well-being, how I felt. So light on my feet, you know. So I really didn't know what I had because I had them for so long.
Hey, you had just gotten used to it.
Yeah,
feeling that way.
I became accustomed to them because I actually started with varicose veins in my late 20s. So over the years, you know, I'm now 75. So after, you know, 50 years of dealing with varicose veins, you kind of become accustomed to it. But with the help of Ovi and Dr. Pravasti, it's like a new thing.
Congratulations. What was the treatment? What did you do specifically? Because I know that there are different things you can do depending on the condition of the legs.
Sure. One of the biggest things that we did after the ultrasound is, as we're going through the treatment plan, there are different treatments we can do. And based on either the diameter of his vessel and the severity of the varicose veins, we just decided in order, you know, first we had to close down the root cause of the problem, and then we went on and took care of the rest of his symptoms as well.
And how did you go about doing that? I know they're different. There's sclerotherapy. Which therapy did you use?
Well, we first started off by doing ablations. And that's closing off the actual vein that's feeding his varicose veins that's causing the discoloration.
And how do you do, what's the ablation like?
The ablation, and we'll see a picture shortly, is when we insert a small little catheter inside the vein, and you can see how small the incision is. It's about 1 millimeter. And that catheter goes up the leg, and as we numb up around the vein, we slowly pull that catheter back, and that just collapses the vein. And at that time, there is no more blood in that vein, so it's not feeding those varicosities anymore, and that really does alleviate the look of it and the symptoms that you have as well.
And you know, Ovi, we've had, when VEINatlanta has been on the show before, we always tend to have women patients, but it's a common misconception that men don't really get varicose veins. That's obviously not true. So talk about risk factors for both men and women.
Right, it's funny because I was just telling him before we got started, I said, you know, probably the main reason why that's a misconception, is because men don't like going to the doctor.
Sure. I know. We
so you
talk
wait
about
till
that
the
all
last
the
minute
time.
to
Men, go to the doctor. Go check make
No.
sure you get your yearly checkup so things like this don't happen.
Absolutely. And although, women are at higher risk of having venous insufficiency, varicose veins, spider veins, so are men, because the number one reason, the number one risk factor for having them is it's actually hereditary.
Yeah.
So I know Leroy's mother had it.
My mom has it too. It
and so
scares
just
me.
passes down. It's hereditary, and either extreme of standing too much, prolonged standing,
Right.
wearing heels, or prolonged sitting can also be contributing factors as well.
Leroy, what was that like for you? The ablation. I mean, we saw the picture with the needle going in.
Just believe me,
Not bad.
it is the easiest procedure that I could have possibly imagined.
Good for you.
There is nothing but a little pinprick, and from there on, you're home free. But part of the advantage that I've had is that, strangely enough, I've lost a shoe size.
Really?
Yeah.
Not only have I lost a shoe size, but for the first time since my early 30s, I am now regrowing hair on my calves.
That's incredible. Have you also noticed the discoloration? I would imagine if you've collapsed those veins that his legs aren't blue and green anymore. Is that better?
Yes, very much better.
Oh, that's fantastic. Now, after seeing Dr. Pravasti, you realize your neighbor had been to him before, but not for vein treatment. Tell me about this.
Yes, it was very interesting that when I started the treatment, mentioned to our next door neighbor that I was being treated by Dr. Pravasti, and she just kind of opened her eyes and said, "My God, Dr. Pravasti saved my husband's life." This is back when Dr. Pravasti was a cardiovascular surgeon.
Wow, that's incredible.
So yes, so there is definitely, when you have a cardiovascular surgeon
Working
on your legs,
Yeah.
you know that you have an expert.
Right, you're in good hands. And Ovi, I imagine the fact that he is a surgeon makes him stand out apart from other doctors. And what would you say, what else contributes to him being kind of second to none when it comes to choices for vein help?
Right. I actually think the fact that you said he stands apart is actually an understatement. I think he stands alone when it comes to the vein practice. He's in his own category because he's phenomenal. Besides the fact that he's been a cardiovascular surgeon, he owns and operates his own vein practice, which is huge. He knows the vascular system, the legs, the whole body. He knows it extremely well. And his bedside manner when he meets patients for the first time.
Sweet.
He's a great guy.
He's gentle,
And so,
yeah.
the bedside manner when you first meet a patient he's just so gentle and kind. And then the fact that he does every procedure that's needed to treat any kind of vein problems in the office is a big deal as well.
Thank you both for being here. Leroy, congratulations. Thank you for coming on the show and telling us your story. And Ovi, it's always so good to see you. Give the doctor our best. And for more information about Vein Atlanta, call 404-446-2800 or visit their website at VEINatlanta.com.